Hi, I'm Dr. Armen Oganesian, and today we're going to be talking about endoscopic spine surgery. So, endoscopic spine surgery is currently, I believe, the least invasive form of spine surgery that is available to our patients in the community. Endoscopic spine surgery is performed with a camera that's about the diameter of a pen, slightly longer than a pen, and we're able to guide this down to where the area of the pathology is that we're trying to address. If it's a herniated disc or a blocked nerve or a stenotic region that we're trying to decompress. So we put the camera down there, and through that camera we have various working tools that we use that you would normally have for an open case, but this is a lot smaller and miniature version of the same instruments that you're able to put through the camera to try to accomplish the same surgery that you would otherwise do open. The current surgery that most people are familiar with when it comes to, let's say, taking care of a herniated disc is the microdiscectomy. That's been around for decades now, and so our patients are used to that verbiage or that word microdiscectomy. And there is a significant difference when it comes to microdiscectomy versus endoscopic spine surgery. Also, with microdiscectomy, as you're trying to get down to the area of the pathology, the muscles and some of the ligaments have to be detached from the bony surfaces, and this can render the area somewhat unstable afterwards. So by the very fact that you're detaching more of the living tissues off the bone, leaves a lot more scar tissue and footprint, versus with endoscopic spine surgery, you're not detaching any of the muscles or the ligaments from where they normally would attach. You're really dilating through the muscles, and you're sparing all the soft tissues as you get down to the area of the herniation or whatever pathology is that you're trying to address. Here I have a little model of a spine, and with endoscopic spine surgery you can take a couple different approaches. One approach is coming from the back, or you're coming from the side. It really depends on where the pathology is, where the herniated disc is. If the disc herniates directly through the back side of the disc, then we'd like to come, from the back to address it as such. If it herniates from the side, then we come from the side. But the length of the size of the incision doesn't really change. It's still, the incision is about 1/4 of an inch to allow and accommodate for the camera. That the camera we can guide down through the back or through the side to target the pathology. Endoscopic surgery is preferred amongst my patients for many reasons. One is the recovery period. Overall, the recovery period for endoscopic surgery is a lot less than the recovery period for any of the other approaches. Also, the postoperative pain. Postoperative pain is a lot less. When they wake up, most of the pain can be managed with some over-the-counter medications, icing. All of my patients go home the same day after endoscopic surgery. Essentially, after a few hours from waking up from anesthesia, they're getting dressed to go home. There's no overnight stay with endoscopic spine surgery. I think that's some of the reasons why my patients prefer that, and also the fact that they can get back to the things that they enjoy faster is the number one reason why they prefer endoscopic surgery. There are a few remarkable cases of endoscopic surgery that I can remember. One in particular was a gentleman in his early 70s who was debilitated by a herniated disc in his lumbar spine. And he really enjoyed playing pickleball. That was kind of his favorite activity to do with his wife. And since the herniation happened, he was unable to do it. And when we performed the endoscopic surgery, he was seeing me the next week after surgery. We took off his dressing. I let him go back to playing pickleball the very next day, and he was as happy as he could be, and so was his wife. I think what sets us apart here as opposed to other surgeons who may be performing this technique is the fact that I trained with this technique in my fellowship, performing over 70 cases. I also would like to form a relationship with my patients and see them through their recovery. I am still myself intrigued and surprised as to how well they recover, so that's something that I continuously want to improve and keep track of with my patients and see how they do over the time that we perform the endoscopic surgery and their recovery. Currently, you can't find endoscopic surgery in most of the areas where spine surgery is offered. In fact, 95% of the areas where spine surgery is performed or offered, endoscopic surgery is not something that's offered in that same area. We brought endoscopic surgery to the Thousand Oaks, California area in early 2021. In January, we were able to acquire the special instruments, the cameras and the screens and everything that's required for endoscopic surgery. And we've had many successful cases since January of 2021. I'm Dr. Armen Oganesian, and I look forward to helping you heal.